Welcome to ChallengeCancer.com, your online resource for scientifically sound, holistic support for those who have cancer concerns. My name is Dr. Kim Dalzell. I'm the founder of Cancer Control Mastery and an international speaker on cancer and nutrition. Today, I'm thrilled to introduce someone who I counseled many years ago, and I am delighted to be reconnected with him. Let me tell you about Robert Miller. He is a semi-retired real estate agent who lives in Cape Coral, Florida, with his beautiful wife. He was diagnosed with pancreatic cancer in 1996 and was told to get his affairs in order when the cancer had spread to his lymph system. He took charge of his health and has been thriving ever since. He recently wrote a book outlining the regimen he used to beat pancreatic cancer, called How I Beat Pancreatic Cancer by Robert Miller. So welcome, Robert.
Thank you very much.
Yes, we're going to get started. I did give a brief version of your personal cancer thriving story, but please expand on that.
Well, Dr. Kim, it was in 1996. I was living the good life. I ate anything I wanted. I was a heavy drinker. I was at least 40 pounds overweight. My cholesterol was through the roof in excess of 350, and my triglycerides were even higher than that. So having visited my GP, he put me on Lipitor to reduce my cholesterol. I was riding along with that for about 2 weeks until one evening after my wife and I had celebrated my birthday. We were getting ready for bed, and I was bending over removing my socks when I had a shooting pain that went through my chest. Felt like somebody had taken a knife and stabbed me. Of course, I'm not familiar with how that feels. I just imagine that. The only thing I could think of was I was having a heart attack, and I stood up immediately and took a deep breath. The pain went away. Didn't think anything about it that evening. Next morning when I went to the restroom, a change had taken place, and my urine was a bright orange. So I figured there was something going wrong within my system, and I needed to find out. So I made a doctor's appointment. And by the time I got to see the doctor, I had started to jaundice, and he was convinced I had hepatitis C, ran tests for it, didn't result in anything but negative results. So they put me into the hospital, further examinations. After some time, they determined I had pancreatic cancer. I was introduced to a surgeon, an oncologist, and they laid out a program for me, which was a Whipple procedure, chemo, and radiation. Now, bear in mind, I'd never been ill. I had no idea what was going on. These guys just kind of took over and managed my health from then on. Had I read the things that I have read over the past 22 years, I doubt that I would have allowed them to do what they had done. Not saying I wouldn't. I'm just saying there's so many other things that are available, and these doctors seemed comfortable with what they were suggesting. I had absolutely no idea what I was getting into. But anyway, having told you that, the one thing that started me to change my idea about how I was living was the fact that when I was in the hospital, a couple of days after the surgery, my heart stopped. I actually died. And the reason I died was because I did not have any electrolytes in my system. Now, here I am in a modern hospital, well-educated doctors, nurses as well, and they let me die. So it set up a lot of red flags for me, and I started to realize, your body doesn't function unless it has the right vitamins and nutrients, and that was a big learning episode for me through my reading and my learning curve that happened over the last 22 years. But anyhow, once I was discharged and once I had completed my regimen through the medical community, after my surgery, I started self-medicating myself by taking a lot of vitamins and minerals, and I still do that today. They just said everything was, forget it, wouldn't make any difference. And, of course, I made a drastic change in my lifestyle. I started a plant-based diet. I gave up alcohol. I just don't eat the things I used to eat anymore because the habits I had before certainly helped the cancer manifest itself. And I feel that if I had changed my lifestyle in the very beginning and didn't eat and didn't drink like I did in the past, I don't think I would have had the pancreatic cancer. However, I think I would be dead by now if I hadn't changed it, if the pancreatic cancer hadn't materialized, because I probably would have had a heart attack or something worse because of my lifestyle habits.
Mm-hmm. Well, let's talk a little bit about that. Obviously, I also believe that nutrition is very important to fighting cancer, but what made you, why do you believe nutrition is a key component to cancer fighting?
Well, like I said, when I died in the hospital, and the reason that the heart stopped was because there were not sufficient electrolytes, and electrolytes are vitamins and minerals. And so that was a big red flag for me. And the more I read at that time, there was too much evidence that food had a lot to do with the general health of the individual. And over the last few years, it's become even more apparent that a plant-based diet is something that can be incorporated to control chronic disease. And it's also been related to stopping and helping to prevent different types of cancer. So I got on the right road early without even realizing it. The doctors said I was lucky, and they wouldn't have anything to do with what I was doing. I told them everything I was taking, every vitamin, what I had done as far as changing my diet. And they all just sort of, patted me on the head and said, yeah, that's fine. It's not going to make any difference. However, after I made my 5-year anniversary for surviving, the oncologist that I was going to hired a full-time nutritionist to work with his patients.
Oh, wow. So look at how you even helped convince a medical doctor. That's pretty good. Well, tell me, can you share, and realizing that your diagnosis in the past of pancreatic cancer and your thriving of that is specific to pancreatic cancer, but the reality is that there are many people who are cancer concerned and want to be empowered thrivers. So I would love for you to share 2 or 3 key ideas or suggestions or tips for them that really you would want people to know who are cancer concerned.
Well, there are probably 3 things. And the first one is read. Get your hands on as much material as you possibly can and read about what the cancer is that you have. I can't tell you how many books I've read and what the material told me, other than the fact that diet and cancer go hand in hand. And I would recommend that anybody that has cancer or has or wants to keep it away is to change their diet. In Colin Campbell's book, The China Study, he makes a very good case that animal protein feeds cancer. So if you're ingesting a lot of animal protein, just beware. I would immediately tell you to stop drinking any alcohol whatsoever and immediately adopt a plant-based diet. Those 2 things right there would be absolutely amazing for anybody that is dealing with cancer. And also, if you have had cancer and been treated and the doctors now tell you you are in remission, that scares me because there's a lot of difference between remission and cure. And when you deal with a cancer doctor, ask them specifically, with the type of cancer that you have, how many patients have they treated and how many have they cured? That's the big word right there. And you'll be surprised at what their answer is going to be. So find out as much information as you can about the type of cancer you have, adopt a plant-based diet, and also take supplements. just because you're eating properly doesn't necessarily mean you're getting all the nutrition that your body needs, and your body cannot put up a good battle or fight for any disease without proper nutrition.
Oh, I got to tell you, I agree completely with everything you just said, and when you especially talked about the difference between remission and cure, people get a false sense of security when they're finished with treatment, and they say, okay, go off on your way. You must change that growing environment. You know you can do that by adopting that plant-based diet, taking dietary supplements, which I believe in as well, and reading, getting empowered. I mean, those are, oh, I wish everybody had your brain. It's so fabulous. So is there anything that you wish everyone would know about thriving after a cancer diagnosis? You are proof positive that changing that growing environment, being an empowered person can make a difference. You were born to live. There's no doubt about that in my mind. So anything you wish that you would like everyone to know about thriving after that diagnosis?
Well, once you're diagnosed, it's not the end of the line. It's just that you have a battle in front of you, and you want to get in the battle. You want to give your doctors as much help as they possibly can use, and that's by changing your lifestyle. The cancer developed for some reason, and it is going to come back if you don't change the way you were living, and that includes eating, supplements, no alcohol, all the good things that we enjoy. But believe me, a plant-based diet is very enjoyable. It's unless you've tried it, you don't knock it. But don't give up hope. There's always hope. They told me I had a year to live, and they're still amazed that I survived, but they don't want to give credit to anything except themselves, and they're not taking credit for anything, because I asked each one of the doctors if they would take credit. They said absolutely not.
Well, you know what I really appreciated about what you just said is that you can give doctors as much help as possible. You see, everyone plays a role in the healing process, including the patient. And I love that you brought it to that angle where it's like, you know what? Doctors are going to do surgery. They're going to give you medications. What can you do to help them, their job, be so much more effective? So I love how you frame that up, because it's really easy to blame a broken medical system, to blame the core philosophy differences in people who, many of the physicians who are going through medical school who don't have any orientation to nutrition. And yet we must also take responsibility for ourselves. So I just love how you were very compassionate toward those doctors, at the same time being very empowered. That's beautiful. I've never heard anybody ever say it that way. And this is why. This is why you're awesome to me.
May I add one more thing?
Sure.
My regimen is not instead of medical service or medical work. It's in addition to. Mine is an add-on to whatever the doctors are doing. So pretty much what you just said.
I love it. Love it. Okay, well, I know people are going to want to know. You're so well-spoken, and I have read the book. I love the book. I gave it a great review, and it's just an important resource, and your story, how it unfolds more deeply in that first chapter, it's absolutely a must-have for anyone who's looking for inspiration, education, and really coming from somebody who's been there and done that and is out to see the other side. So where can people find out more about you? Do you have a website? I know your book is out there online. Tell us how people can find out about you and your book.
Dr. Kim, I do not have a website. However, the book is available on Amazon. All they need to do is type in the name of the book, which is How I Beat Pancreatic Cancer. It'll take them directly to the book. It's available in a paperback, and it's also available in Kindle format. So if anybody follows up and purchases the book, I would certainly welcome a review after you read it. And, I just wish you good health, and hopefully it'll benefit somebody that's out there struggling, trying to figure out what they need to do.
Oh, I'm going to encourage everyone, pick up the book, and it's by Robert Miller. Luckily, you have an easy name, Robert Miller, Miller, on Amazon.com. I also saw it on BarnesandNoble.com, so check that out. This has been wonderful, Robert. I can't thank you enough for your time, your caring, your dedication not only to thriving yourself, but being a support to individuals who are going through their own healing journey. So until next time, this is Dr. Kim Dalzell of ChallengeCancer.com, wishing you wellness and wholeness.